If PPO discounts are so great, why do your costs keep rising? What if the scary stories that you've heard about reference-based pricing are actually avoidable? I'm Rich from BeneSmart, and we help mid-sized companies move away from overpriced carrier plans without sacrificing access or quality. Today, I'm going to be walking you through what reference-based pricing is, how employers are using it today to cut costs, and how companies like Freestone Land Group and Todd Interest Developments successfully made the leap away from Blue Cross without the drama and employee pushback. Let's get one thing straight. If you're using a traditional PPO or HMO, whether it's Blue Cross, Cigna, or Aetna, you're not paying market rates. You're paying whatever the carrier and the hospital agreed to behind closed doors. And those discounts that they brag about, well, they're really just marked up retail prices with a fake markdown for your PPO discount. That means that a simple MRI can cost $3,000 at one facility and $300 down the street, and your plan has no power to say no. Reference-based pricing flips this equation. Here's what most employers don't realize. That PPO contract you sign locks you into a system where you're legally bound to overpay. Hospitals love it, carriers love it, your budget, not so much. You end up footing the bill for egregious markups, $80,000 C-sections, $25,000 knee scopes, $10,000 drugs, and you're stuck. The worst part, you don't even get to see what those services should cost. No transparency, no leverage, zero accountability. And if you've ever wondered why you're fully insured at level funded rates keep rising despite good claims years, this could be a big part of it. This is where reference-based pricing comes in. Instead of relying on the carrier's negotiated rates, RBP sets a reimbursement based on a public benchmark, usually Medicare. It's not arbitrary, it's not reckless, it's just simple math. What you get is predictable pricing, fair reimbursement, and finally, some form of leverage. Here's the kicker. When it's done right, members hardly even notice the switch. Let me tell you about two employers who did this right. Freestone Land Group and Todd Interest Development were both on Blue Cross plans, paying premium rates, watching costs rise, and getting nothing in return. They've tried every trick in the book. They implemented higher deductibles. They shifted more costs onto the employees. They looked at HRAs, but they weren't getting anything in return. We helped them transition to a reference-based pricing plan built around virtual primary care. Same core benefits, lower premiums, and most importantly, minimal member disruption and no flood of balance billing complaints. Just a smarter plan that saved money without sacrificing experience. And that's the whole point. RVP doesn't have to be a horror story. If you have the right guardrails in place, it works. So how do you do it right? Well, here are 3 guardrails we use for a smooth transition. First things first, check in on existing care scenarios. You want to be able to ensure a smooth transition for members, and this can be done by reaching out to existing provider relationships prior to making the switch. Next, you want to make sure that you have a solid member support strategy as well as an advocacy team. If an employee gets a balanced bill or a scary letter, they need a human to call right away. And then third, make sure you have a strategic plan design. Don't go pure RVP on day one for every claim. You can use a physician-only network where it makes sense. These rates are already pretty low, or you could look at doing a dual option for a softer landing and still have a network plan available alongside an RVP plan. It's not about going scorched earth here. It's about being strategic. And if you're sick of paying carrier markup with zero say in the matter, this is your chance to break free. We've helped companies like yours lower costs, upgrade benefits, and regain control. And we can show you exactly how to do the same without triggering an employee revolt. Book a call. We'll walk you through our playbook and show you how RVP could fit into your benefit cost containment strategy. Because better outcomes start with better decisions, not bigger budgets.